Hello, this is Ben Gelfand from Technique Peaks. Today I would like to talk about hip mobilizations. More and more we're seeing people post-operative from hip arthroscopy. We're also seeing a lot of hip arthritis. Both of these problems or procedures result in decreased hip motion, therefore resulting in hip pain or hip impingement. So first, and mechanics are going to be very important, so you may have to play around with your mechanics, but I like to do it with foot on shoulder, so we get it at 90 degrees. So we're already taking up some slack of the capsule. You have to get a little up close and personal, and you may want to tell the patient that. With your hands intertwined, you could go and scoop right into the hip fold of the hip. You're obviously not going to feel the femoral head, but you should feel really as proximal of the hip as you can. Then you want to go into neutral position and just pull straight down. Now, through the camera, you may not be able to see much movement, but I can feel and the patient can feel the movement, and you go by the ease of movement and the ease of the end feel. The end feel we're looking for is a capsular or a soft end feel. So this is a straight inferior glide. Now, to get other aspects of the capsule, I like to go into external rotation and do the same technique, staying directly inferior since the leg is now already into external rotation, coming straight down, feeling the end feel, and feeling the journey towards that end feel. And I like to do a series of 5 mobilizations. I like to go all the way to grade 4, no thrust, but just to the end range, all the way, so you feel the slack being taken up. Then I like to go into internal rotation. I have to change mechanics. Now, to go internal, which is really the range of motion to which you would have the most likelihood of impingement, I would scoop and go into distraction and then go into internal rotation by rotating the leg with my shoulder and neck. Very important that before you let go of the traction, you bring back to neutral and let go. If you don't do that, you will cause hip impingement and the patient will feel pain. This is Ben Gelfand for Technique Peak.